what's up? It's me, Princess Ricky, and welcome back to Surgery Squad. This one's tonsillectomy.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff. Today we'll be removing a young man's tonsils. This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle. Tonsils are infection fighters, but occasionally they lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Okay. Get in there.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position. Why don't you take a crack at that?
I can't hear anything that's going on. What was that, Jeff? I wasn't paying attention. Okay. What do I have to do with you? I'll show you. Probably not move the actual game itself. That'll be a bit of a head start, Ricky. About there. What do you do? Oh, okay. It goes over your muff. It's over your muff.
Great job. That should give us plenty of room. Now we have to reach in and grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
No, but I guess I don't have a choice. Okay. I'm sorry, dude.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time. By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out, would you?
No, you do it. You're the doctor.
We'll bring the electrocautery device back in here and apply it to any bleeding areas.
You did a good job first, did you? Yeah, Dr. Jeff.
Because this part of the throat heals quickly, we won't need any stitches. Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil forceps.
Oh dear. Okay. Sorry, dude.
Just like the other side, we'll cauterize this tonsil to release it, while keeping blood loss to a minimum.
It was like terrified to have it done.
And finally, we need to remove the tonsil.
Don't make me do it. You're making me do it.
And don't forget those bleeders.
You had two baby twins. Ew.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
Oh yeah, you had to ease it off.
We'll send our patient to recovery for 8 to 10 hours, and more than likely, he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry?
No.
Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
Now let's try teeth whitening. Let me do teeth whitening? Or can I do it this way? Teeth whitening. No, I'm not pressing camera. It's alright, OBS is getting confused. Did it? I got Flash. Flash! Ah, savior of the universe. Hello. I don't want any further education, thank you. Here it is. Alright, start. Who have we got? Is it Susie or is it Jeff? Scalper. Here we go. Susie.
Hello, and welcome to Surgery Squad's virtual teeth whitening. I'm Dr. Susie, and I'll be guiding you through this procedure today. You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A whiter smile looks healthy, plus it can improve your overall appearance and self-confidence. Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration. A teeth whitening procedure can remove those stains caused by age and the things that we eat and drink. There are a variety of ways to do it. A whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, whiter smile, you do need to know that whitening is not permanent, and a whitening program, whether you do it yourself or have it done by a dentist, might not always lead to the results you want.
After you get left like the braces
If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure. In addition, a dentist will not perform the procedure if you have gum disease or your teeth have worn enamel. If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others. Our patient today is a 27-year-old woman who has opted for an in-office dental whitening. She's a tremendous admirer of coffee, but she wants to impress the folks at her 10-year class reunion with a bright, white smile. So let's scrub up, glove up, and help her out.
What, her out?
Our hygienist has already cleaned her teeth to remove all of the plaque. So let's start by matching our patient's current tooth shade with one from our shade reference guide.
Some lip balm. Okay. Use the shade guide to determine the patient's current teeth color. Yellow.
Okay, we've got our starting shade. Let's see if we can make them more like this.
BL.
First, protect her lips and tongue by covering them with these rubber guards.
What? Please don't hear what I think this is.
Nice work. Now we need to cover her gums and papilla, which are the tips of her gums between her teeth, with a special coating to protect them from the risk of chemical burns when we use the bleaching agent.
Okay. Click and drag to apply the protectant to the gums. Okay. This is going to take forever. But it's only doing an outline. I'm not colouring it all in. I'm not colouring it all in, love. You'll be fine, man up. I've got to do these too. There. That's fine. You like you've been eating ice cream. That'll do. Finished.
Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water. That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth. Cover each tooth evenly.
No, we're not using a toothbrush. What's this? Click and drag to apply the peroxide to the top teeth first. Press continue when done. Okay. Peroxide's yellow. Leave red. Leave brown. Alright, I did it proper. Show off my artistic skills. So see, I'm lacking artistic skills. Come on. It's taking forever. What if I just do this? Does this work? My artistic skills have gone out the window. So is my attention span. Okay. You look like you got gum disease. You look like you're bleeding. We're almost done. Nearly beautiful. You get that bit there. And this bit here. This bit there. Alright, you're covered. Right, continue. Continue, Susie. Click and drag to apply the peroxide to the bottom teeth. Just like hair dye. Just like the spray ones in the cans. Like the glitter sprays. Or like the crazy green colours and stuff. Tennis ball colour green, as I call it. Okay, nearly finished. Get that little bit there. Spit on that tooth there I missed. Okay. Now you look like you got pumpkin for teeth. Okay?
We keep this solution on her teeth for about a half an hour.
So easy is this?
Let's see what kind of beautiful smiles underneath all of this red stuff.
You look evil.
Take some water and gently wash away the carbamide peroxide.
What? Click and drag. Okay. Oh, your teeth are matching the white stuff we put on first. Oh my god, your teeth are so white. Like Casper. Come on, get rid of all the blood. Take back about what you said about you having gum disease. Jesus. Alright, get rid of this bit. That bit's annoying me. Alright, we're done the top. You have to do this one too. Oh, not yet, not yet. Okay. Now I've got this one. Come on. No, this bit a bit there. And then a bit over in this bit. There we go. I see any more red? I see some more red. Is that part of the gun? So let me get to it. Okay.
Now with our dental pick, simply pop the protective coating from her gums.
What? Oh, okay. Oh my god, it's so satisfying.
Great work! I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion. But for now, her teeth will probably be sensitive for a few days. She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days. If she smokes, well, now would be a perfect time to stop. This bleaching will most likely last for 2 or 3 years, so she'll want to make this an ongoing part of her overall dental care. She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today.
Thank you.
While you're here, try your hand at one of our other surgeries available at surgerysquad.com.
Alright, I guess we'll do liposuction. I never thought I'd say in my life. Thing that I struggle with is like after uploading these videos, like I'm doing the title, I write down the names of like the video, like type of surgery. There's no way I remember all of these. Start. Yeah. So up, up. Trying to skip out as many of the ads as possible.
Welcome to Surgery Squad's virtual abdominal liposuction. I'm Dr. Susie, and I'll be assisting you with this surgery today. Liposuction is a minimally invasive surgical procedure that is used to remove fat deposits from various areas of the body. The areas that liposuction is generally performed are the abdomen, hips, inner and outer thighs, flanks or love handles, and inner arms.
The cupcake.
Today we'll be using the tumescent technique to remove fat deposits from our patient's abdomen. The word tumescent means swollen and firm, and with this technique we'll be injecting such a large volume of the fluid into the fat deposits that our patient's abdomen literally becomes tumescent. After injecting the fluid, we'll be using a hollow metal tube called a cannula to break up and essentially vacuum fat deposits out of the body. Before we begin, remember that liposuction is not an alternative to diet and exercise. And, unfortunately, not everyone is a good candidate for liposuction. To be a good candidate, one must usually be over 18 years old, in good general health, be within 30% of their ideal weight, and have made an honest attempt at losing weight through dieting and exercise with little success. Luckily, our patient is not only a great candidate for liposuction, but she doesn't smoke, which will greatly speed up the recovery process. Now that we've covered the basics, let's scrub in. The first thing we need to do is mark the target area. This provides our patient and ourselves with a clear idea of where we'll be removing fat deposits. Why don't you give it a shot?
Oh dear, I have to do it. I've got a trace. Okay, my wonderful artwork. Sorry, dude. Lady. Shite. This is so hard on the touchpad. It looks like I'm drawing a kid. Like, you got the hair and you got the ear. Okay, do kid's ear this side, I guess. Dude, you got a messed up ear. Okay, may as well give you some eyes. There we are. This looks so bad. Give you his nose. Look like you got a beak instead, but hey ho. And do you a smile. There we go.
That looks great.
Oh.
Now we need to take photos of our patient so she can see the before and after results. Go ahead and take one picture of the front of the patient's abdomen and one picture. Next, we'll have our patient turn to the side so you can take the second picture.
Smile, pretty, pretty. Ooh, nice underwear anyway.
Nice composition. Our patient has been prepped and is now in the operating room. The next step is to numb the incision points that we're going to use to extract the fat deposits.
Please don't be needles.
Give it a try.
It's needles. Like, I'm not scared of like needles, like having them. It's just like hurting people's skin bothers me. Because like you don't know how far deep to go in. And I'm scared that I'll end up like stabbing them. Like, someone injecting me doesn't bother me.
With the incision points numbed, we're going to inject the tumescent fluid using an infiltration cannula to anesthetize the target areas and dislodge the fat deposits, making it easier to suck them out.
Okay.
Go ahead and take a stab at it.
Don't say that. She's bleeding. The kid's head's getting bigger. She's gaining weight. Sorry kid, we're filling you up like a balloon. Oh, I can do this in real life.
Excellent job. Now that we've injected the tumescent fluid, let's begin the liposuction. Use the suction cannula to remove the fat deposits from the patient.
A woman had a, what are they called? Hernia. And you put like the hernia bag and everything, like change it. That's the only time I've ever passed out was doing a hernia bag. I can't do hernias. But like changing catheters and everything I can do. It's just like literally anything with organs hanging out of the body. No. Click on each fat cluster to remove it. Okay. It kind of looks like a beehive. Reach that one? No, I've got to make another. Go in you again. It's such a weird noise. Digit. Okay. Can I come out now? Oops, I'm moving the thing down there. Excellent. Okay, come out. Okay, last one. I got this. I can destroy the beehive.
You're a natural. Have you ever considered a career in the medical field?
No.
Now that we've completed the liposuction on our patient, it's time for recovery. We're not going to suture the incisions. Since they were so small, they can heal without sutures.
Okay.
Our patient will need to wear a compression garment for 2 to 6 weeks. This garment holds the tissues together, controls swelling, and provides additional support as her body heals. She should be able to return to normal activity within a few weeks, and there will still be some bruising that should fade within a few days. Any swelling that our patient has may take a little while longer to subside. The final result of the liposuction will be evident in about 1 to 3 months after the surgery, although they will see a noticeable difference within days or weeks. Although the suctioned fat deposits are gone, if the patient does not maintain a proper diet and exercise regimen, the remaining fat deposits could enlarge, creating irregularities in the patient's abdomen. And that's abdominal liposuction. You've done a fantastic job. Why not try your surgical skills in another great surgery here at surgerysquad.com.
Alright guys, I'm Princess Ricky. If you like this video, don't forget to like, comment, subscribe, follow me on Twitter, Snapchat and Facebook at Princess_Ricky1, and I'll see you in the next